Denver, Colorado with our patient Haley, who is 31 weeks pregnant.
Yeah, 31, 32.
And we're going to be demonstrating the Webster technique, which is a technique that we use often in pregnancy. So Haley, go ahead and lay on your stomach. Get comfortable. All right, so one of the first things we do with the Webster technique, make sure our patient's very comfortable, is we're going to actually check for any tension in her legs or her quads. So Haley's just going to let me know too if she feels like one side moves a little easier than the other. I think this side moves a little bit easier than the other. So we're going to do an adjustment called a drop table adjustment. This cushion pops up about an inch. When we push down on the right part of her sacrum, based on our palpation findings and our leg check, that's going to drop about an inch. We're going to do that a couple times. We're going to recheck. So there are about 100 years of data on the Webster technique and how it works. We're going to also talk today a little bit about what it does for Haley. So the number one thing the Webster technique does for Haley is it makes sure that she is preparing her body for a really easy or easier labor and delivery. Okay? So one of the things that we're doing is we're checking her sacrum. Okay, that's the bone right between her pelvis on the back. And the Webster technique really works to centralize and find balance in the sacrum and the pelvis. All right, so there actually also could be a joint fixation around the sacrum, which is what we're going to adjust next, the left side of her ilium. So I want you to hop up to your hands and knees for me. Take that cushion out. And I want you to lay on your side facing the windows, please. Just making sure you're very comfortable. Make a deep adjustment right there next to the sacrum. Perfect. Go ahead and lay on your back. So you got a nice little release there. The other thing that the Webster technique does is it creates an optimal amount of space for the baby. So we definitely do not say that the Webster technique helps with baby positioning, but years and years of clinical data have shown us that when the baby has more room to move, they will usually find a good position to be in for birth. So what we're doing right now is checking her round ligament. The round ligament is one of 3 ligaments that help support the uterus in the pelvis. There's a broad ligament, uterosacral ligament, and round ligament. This is the only one that we can So in addition to checking her round ligament, adjusting her sacrum and her pelvis, it's really important that the psoas, or the hip flexor muscle, is nice and loose during pregnancy. That also helps make sure there's enough room for baby to develop. We're just going to do a little passive stretch in through here. And the third thing the Webster technique does for pregnancy, or for patients who are pregnant, is just make them more comfortable. Because pregnancy is a long road, and you want to make sure you're as comfortable as possible while you're growing this life inside of you. So getting adjusted during pregnancy is really important. We recommend about every 2 weeks, sometimes once a week, depending on what somebody's got. All right, so during pregnancy, it's also really important to make sure that we're addressing the whole person. And Haley has some neck pain. We're going to make sure we address that with an adjustment as well. And lastly, we will check her upper back. Those feel okay?
Yeah.
Wonderful. All right, well, thank you so much for letting everybody see what the Webster technique looks like. I really hope it helps everybody realize that it's safe, comfortable, and makes everybody feel better after and maintain their pregnancy, and hopefully have a